Our center is housed within the Pacific Inclusive Education Research and Resources Center, or PEER for short. PEER is managed by faculty and staff at the Center on Disability Studies located on the University of Hawaii at Manoa campus. The overarching goal of our center is to nurture untapped talents through inclusive practices. To reach this goal, we host monthly speaker series as well as in-person symposiums that focus on building awareness on neurodiversity and voice exceptionality. Our speaker series and symposiums are made possible through funding from the U.S. Department of Education, Jacob K. Javits Gifted and Talented Education Program grant. Each month of our speaker series will focus on a different topic and perspectives from well-known speakers in the area of inclusion, neurodiversity, and education. I am happy to introduce today's speaker, Dr. Matheis. Dr. Matheis is a licensed clinical psychologist and faculty at the Center on Disability Studies at the University of Hawaii at Manoa. She has over 15 years of experience working with autistic individuals across the lifespan. She completed her MSW at Washington University in St. Louis, her PhD in clinical psychology at Louisiana State University, and her postdoctoral training at the UC Davis Mind Institute, where she completed the Autism Research Training Program, or ARTP. Her research interests focus on mental health needs in the autistic population and community-based implementation of interventions for autism, with particular emphasis on training and support for non-specialists such as teachers, parents, and community health workers. She has authored numerous peer-reviewed articles and book chapters on topics related to autism. Today's session, titled Conceptualizing Autism and Anxiety, will explore how autism and anxiety intersect, challenge common misconceptions, and provide a deeper understanding through the lenses of the social model of disability and mental health, learn how to differentiate between autism and social anxiety, and gain valuable treatment recommendations to support individuals on a spectrum who experience anxiety. This session is ideal for community members, caregivers, educators, and professionals seeking a more inclusive and informed approach to mental health. As a reminder, we will record this session and post a recording on the PEER website. If you are more comfortable, please turn off your video or rename yourselves. After today's session, we will have a question and answer session. So please type your questions in the chat box or raise your hand during the Q&A session to ask your questions. After the Q&A sessions, we will have some final announcements. But now, without further ado, please welcome Dr. Maya.
Hi, everyone. Before I get started with my presentation, I'm just going to do a quick audio check. I know some people were commenting in the chat that they were having a hard time hearing Jarek. Can everyone hear me okay? Or do we need to make some adjustments?
I can hear you.
I can hear you.
Okay, great. I see some thumbs up. Thanks for that verbal confirmation. So I'm going to go ahead and share my slides. Okay, well, thank you so much for joining this session. Like Jarek introduced, I'm Maya Matheis. I'm faculty here at CDS, and I'm so happy to be talking about this topic, conceptualizing autism and anxiety. I want to apologize. I am recovering from a little bit of a cold. I'm a little bit congested, and I may need to take a couple breaks to clear my throat every once in a while. So I please bear with me for that. Okay, so I wanted to start just by telling you a little bit about me. So I'll start with a visual description. I am an Asian American woman. I have long dark hair. Today I'm wearing a white t-shirt. My background is a Zoom background that's kind of blue with some out of focus circles, and it has our CDS logo and this College of Education at UH Manoa logo in the corners. My pronouns are she, they. I'm a clinical psychologist. I have a private practice in Honolulu, and I am also a research faculty here at the Center on Disability Studies. I'm going to kind of skip through this since Jarek already did such a lovely job introducing me. Today, what we are going to be talking about is anxiety and autism, the intersections, the differences, etc. I do see one person in the chat saying that they're still having a hard time hearing. Is that a singular experience or are there others as well? Okay. Others seem okay. Natalia, if you could adjust your personal settings on your computer, you may have to adjust your volume. So today we're going to talk about anxiety and autism. We're going to do some myth busting about common misunderstandings and just general things that are out there about autism and anxiety. We'll talk about support and treatment recommendations. And then I'll talk a little bit about the medical and social models of disability and how it relates to autism and anxiety. We'll go over some resources that I highly recommend for people, and we'll wrap up with a Q&A. So please hold your questions until the end, or if you want to put them in the chat while you're thinking about them, we'll get to them during the Q&A section. Okay, so I want to start just by telling you a little bit about autism for those of you who may not be as familiar. It's a neurodevelopmental condition, and what this means is that it is something that is rooted in our nervous system in the body, and it affects how individuals communicate, interact socially, and process information. Core characteristics in terms of diagnostics are differences in social communication and interaction. Here we have things like maybe atypical eye contact, reduced interest in group activities, difficulty understanding nonverbal and verbal communication in the same ways that other typical developing people may, etc. And then in the second category, we have things like repetitive behaviors, restricted interests, and sensory sensitivities. So this category can encompass a range of different characteristics, like difficulty with transitions, motor movements, re- repetitive play, etc. So I'm not going to spend a lot of time talking about what autism is. So I hope that everyone is comfortable enough with the information I've given here to kind of think about autism. I do want to mention that it is a lifelong condition. So even though individuals typically aren't diagnosed until they are school aged or over here in Hawaii, it is something that we conceptualize being present from birth and through the lifespan. In terms of prevalence, right now we understand it to affect about 1 in 36 children in the United States. And this is based on prevalence data from the CDC. Okay, so I want to talk a little bit about the autism spectrum. We tend to think of it as very linear, less autistic to more autistic. And this is a very common conceptualization of it, especially when you hear terms like high functioning and low functioning. We're moving away from that conceptualization to thinking about how individuals present in their own skills and presentation. So, in thinking about the spectrum, it's really a variation, so many different ways that autism can present in individuals. And then understanding that it looks different in every individual with autism is really, really important. We're not using terms like high functioning or low functioning just because it doesn't really quite describe the support needs. As someone who is typically high functioning, quote unquote, with a high IQ and good verbal skills, still might need a lot of support in their environment to be successful. And so, therefore, we're not using that terminology anymore, especially moving away from the term low functioning, as that carries a lot of stigmatization as well. So, one myth that I want to start with is that anxiety only occurs in individuals with autism who are quote unquote high functioning. And this is a very common myth. It goes along with this idea that anxiety is something that is very verbal and associated with high intelligence. And this is not true. It affects everyone, regardless of whether they're on the autism spectrum or not. But individuals on the autism spectrum broadly can have autism. And I think that this is important for understanding how individuals who may be perceived as being less capable may still be having symptoms and difficulties related to anxiety, even if they may not be labeling them as such or voicing direct concerns related to worries or anxiety. Here is a graph just to start off with the prevalence of anxiety disorders in autistic adults. So we have here anxiety disorders on the left and depression on the right. And you can see that there are bars for both current anxiety and depression as well as lifetime. And these are very high rates. So 42% of individuals with autism will have anxiety at a clinical level um, at some point in their life. And that's a very, very high percentage. I just want to show here quickly a comparison of these sort of mental health conditions in individuals with autism compared to the general population. The blue bars are individuals with autism. The teal bars are the general population. And you can see here how the blue bars are much higher across the board for all of these. Depression, anxiety disorders in general, social anxiety, OCD, generalized anxiety disorders, paranoia, specific phobias, PTSD, agoraphobia, etc. Everything is much higher. But there is myth, right? It's much higher, and so many people tend to think that it's a core feature of autism that these go hand in hand, and that is not true either. So while anxiety frequently co-occurs with autism, it's not the same. It's not part of the defining characteristics of autism and how it's currently conceptualized in terms of its biology. It's separate, and in terms of its clinical diagnosis, it is separate as well. So, in autism, we see anxiety disorders being one of the most prevalent, as well as the most impairing co occurring conditions associated with autism. And this includes other co occurring medical conditions, such as seizures and epilepsy or intellectual disability, etc. Anxiety tends to be the most prevalent co occurring condition, and we know that it causes the most functional impairments for individuals on the spectrum. Some of the features are similar to the general population, and there are a lot of variances in that as well, as one might expect. But we do see that in general, anxiety symptoms in autistic individuals worsen with age and generally have a significant negative impact on all domains of functioning. In my clinical work, I tend to see that anxiety symptoms are often the most impairing um, symptoms and concerns of individuals that I work with, as opposed to features that are typically defining of autism. And this really speaks to a pressing need to improve anxiety detection as well as treatment for autistic individuals. Here are some more specific prevalence rates when it comes to specific anxiety disorders. So, 40% of individuals with autism also have social anxiety disorder. About 30% have some sort of specific phobia. About 35% have generalized anxiety disorder, and about 17% have obsessive compulsive disorder. So, again, these are clinically elevated levels of anxiety, and these are individuals meeting clinical diagnostic criteria for these anxiety disorders. One of the concepts that we think a lot about in terms of anxiety is this idea of the intolerance of uncertainty. And we know that individuals who have autism, whether they are children or adults, have very high rates of intolerance of uncertainty in general compared to the general population as well. A recent meta analysis, and this is the type of study that looks at a whole bunch of research that's been published in the past and sort of consolidates all of that information, found a significant correlation between anxiety and the intolerance of uncertainty in adults with autism and intolerance of uncertainty. And here are just some stats there. It was a very large effect size. And this is comparable to the neurotypical population. So it's not something unique to individuals on the autism spectrum, but it is a very large um, indicator here. And what we're thinking about this as a concept is that it's an important mediator in terms of how we understand anxiety in autism. And so, to speak more to the mediating effects, I have this graph. So, this visual in the center, we have the intolerance of uncertainty. And so, if you think about an intolerance of uncertainty, that really gets to this idea of kind of wanting to know what to expect, wanting things to be predictable, really liking similarity and routines and things like that. And those are things that often come up for individuals with autism. And we're also thinking about sort of intolerance of uncertainty of um, how things will play out with other people in social situations. So, not necessarily knowing what to expect or understand how people behave definitely might be related to those social difficulties that individuals with autism are experiencing. So, if we look at some of the difficulties that individuals with autism might be having in terms of sensory functioning, being really sensitive to sensory input, maybe some difficulties with emotional awareness and identification, as well as some of the cognitive rigidity characteristics we can see how these types of aspects also might heighten this intolerance of uncertainty. So, these this central sort of mediator we can also conceptualize as being directly related to anxiety symptoms, right? If we are very fearful um, and are really uncomfortable with not knowing what is happening, that can lead to the development of a lot of worries and a lot of anxiety about what's going to come to pass. This also may result in restricted repetitive thoughts and behaviors. So, this is something that is, again, one of the core features of autism, but intolerance of uncertainty may be in sort of like this feed loop where it is exacerbating the tendency of autistic individuals to engage in these repetitive thoughts and behaviors, which may be a result of the anxiety. It may contribute to the anxiety. Anxiety may increase these as well. So it's a uh, bidirectional relationship here. Um, but coming back to this idea of the intolerance of uncertainty really being at the center of our understanding of anxiety. So, another common myth, social anxiety and autism are the same. This is a really common misunderstanding. So, even though autism has a really important social communication to it, it's different than social anxiety. The roots are different. So, we understand social anxiety to be about a fear or worry about how other people perceive and judge us, a fear of negative evaluation by other people. Whereas social difficulties in autism are related to differences in social communication as well as sensory processing. However, we do know that they frequently co occur, as we saw in those prevalence rates before. So, social skills impairments may contribute to and exacerbate social anxiety symptoms. We also know that social anxiety is often related to self perception of social competence. So, if someone isn't feeling confident socially, they're more at risk for having social anxiety related symptoms. We also see that individuals with autism and social anxiety have poorer social functioning than either those with just autism or those with just social anxiety. And that's important here. I want to talk a little bit about how these differ in clinical presentations. So, for individuals with social anxiety without co occurring autism, these individuals typically have social impairments in certain situations, but not in others. So, in situations where they feel comfortable, they typically do much better socially. So, this might be with family; they're doing better in terms of their social performance versus with peers, just as an example. We also see a marked improvement in social communication with increased rapport with other individuals. So, the more comfortable someone feels in a social interaction or a social relationship, the better their social performance. And so we think about the social deficits in social anxiety disorder as a performance deficit as opposed to a skill deficit. So these are individuals who have social skills, but who are sometimes really just struggling to implement these skills in social settings because of the presence of their social anxiety. If we look at individuals with autism, what we see is that individuals do differ in terms of their social performance between contexts or specific people, depending on rapport and comfort level and so on. However, the difference in the um, like the degree of difference in these contexts is much reduced compared to what we would see with individuals with just social anxiety disorder. We also see that reduced social motivation that is often talked about when we think about autism spectrum disorder. And then we also see skill deficits related to socialization. So, this might be things like being able to use and understand gestures, for example, a general skill deficit in that area. That's not to say that individuals with autism can't learn that skill over time and be very good at using it. But the way that they learn and implement that skill is probably very different than those with just social anxiety. So then we have the people who have both, right? These people in the middle. So what does that look like? We see some improvement in contexts and in differences in comfortable um, levels between individuals and relationships, but we still see impairments in social functioning. We also have that reduced social motivation associated with autism, as well as that skill and performance deficit. I think the most important thing in conceptualizing the difference between these two things is whether it's a performance or skill deficit when it comes to social skills. And this is something that I think is really difficult to tease out just by observing someone. It really comes to gathering a lot of information about an individual, seeing them in various contexts, talking to a lot of people who interact with this individual, and really trying to understand the root of what is happening for the individual and where their anxiety is intersecting. A lot of individuals with autism may have anxiety related to social situations, but that might be more this general anxiety related to the intolerance of uncertainty rather than a specific fear of judgment by other people, which is how we define social anxiety. So it's important to understand sort of where that anxiety is rooted as well in someone's cognition. So, in terms of support and treatment, one thing I often hear from clinicians is how much of this is autism. So, they're working with a client who comes in. Um, Someone has anxiety, they might have depression, they might have a variety of other conditions as well, and they have autism. People always want to know, like, what is autism and what is the other stuff? And I don't think it really matters for treatment. Conceptually, I think it matters, and for diagnostics, it matters, and for a lot of other things, it maybe matters. But for treatment, I don't think it really does. We really want to be thinking about a holistic understanding of the individual, right? So we're thinking about the needs of that person, the impairments that they're facing on a daily basis, the barriers that they face in their individual functioning, and whether or not those difficulties are rooted in social anxiety or in um, skill deficits in autism. I don't think it really matters as long as you're treating the needs of that person. So I just want to put that out there while we're talking about conceptualization, because even though I think it's important to be thinking about autism and anxiety separately, the difference in separating it out may not be as important as people want it or conceptualize it to be. So here's another myth. Autistic individuals cannot benefit from counseling or therapeutic interventions for therapy. Or, sorry, that word should be for anxiety. What we do know is that a lot of evidence based interventions that have been shown to be effective for the general population are also effective for autistic children and adults. Just the same. However, we do know that some modifications are sometimes needed to address some of the individual needs of people on the autism spectrum, such as their sensory needs, communication differences, and maybe the need for more structured, concrete approaches. So, this is where we come into our evidence based intervention. Cognitive behavioral therapy, or CBT, is the evidence based intervention that is most recommended for anxiety. It's very common, it's something that a lot of therapists are trained in. And we have found that it is effective for addressing anxiety in both autistic children and adults. So, this is great news. What therapists are getting trained in and what they're doing works with autistic individuals as well. However, what we're seeing is that therapists often don't feel comfortable working with autistic individuals. And this is a big barrier. As therapists are trained, they're taught not to practice outside of their scope of competence, right? You don't want to be doing something that you don't know. You refer to specialists and so on. However, what this means is that individuals with autism often are kind of left out of receiving mental health treatment that is much needed for their anxiety symptoms. And so, really, it's just a matter of making sure that therapists know that what they're doing is effective for people on the spectrum. They don't really need to change that much. What they've learned is helpful. And there's also this lack of willingness that is another barrier. So, this idea of kind of working outside of your comfort zone and maybe trying something a little different than what you do on a day to day basis, that can be scary for people. So, one of the things that I talk about a lot when I talk to clinicians about working with individuals on the spectrum is just this idea of really trying to confront what is preventing you from working with this population. Is it because you don't think you know enough? Is it because you are scared of something? Is it because you have some sort of preconceived notion of what individuals with autism are like or what they need? And to really, really think about sort of the implications of that for the people that you serve, as well as the many, many people with autistic tendencies in our population, diagnosed or undiagnosed, who really could benefit from mental health intervention. I also want to mention that very few people receive any training in working with this population, right? Which goes to this idea of confidence as well as willingness. And I think this is something that needs to change too, whether this is in terms of continuing education and professional development or curricula in mental health education programs, just by kind of emphasizing that, yeah, what you're learning is generalizable to autistic individuals too. And also this myth that people with autism need specialized care, that they need to see a specialist, that they need to be seen by a behavioralist rather than a mental health clinician. Not true. Like I mentioned, there are some adaptations to psychotherapy that are generally helpful for people on the spectrum. There tends to be a bit more emphasis on behavioral strategies, so coping skills and things like that, relaxation skills, things that can be practiced. Using a concrete and structured approach by having um, assigned homework and structured sessions. That's typically part of CBT, but you even may want to be more concrete and structured with an individual who has that heightened um, intolerance of uncertainty, right? Addressing it typically involves a bit more psychoeducation about emotions and social skills, thinking about the skill deficits that individuals with autism might have compared to neurotypical individuals in these areas, as well as the use of more visual aids to support in understanding. um, I really like to emphasize that you can use the strengths of individuals with autism to really build momentum in therapy by integrating special interests. And it's also typically more important to involve a family member or partner in the treatment process to understand how anxiety is impacting the individual, as well as the environmental adaptations and changes that can be made to support. We know that selective serotonin reuptake inhibitors, or SSRIs, are helpful in reducing anxiety symptoms in the general population. And good news, it's also helpful for individuals with autism. So, SSRIs are commonly prescribed. These are things like Lexapro and Prozac. You probably see a lot of advertisements for things like this on TV. And these are very commonly prescribed. However, it is always recommended as part of a comprehensive treatment plan. So, combining medication with therapy is the best way to think about enhancing treatment outcomes. And this is, I think, particularly true for individuals on the spectrum, just because there is this cognitive component to anxiety that goes beyond simply the physical neurotransmitter process in your brain. And so, if you are having social anxiety related to your interactions with others, understanding that, understanding your thought patterns, coming up with coping strategies and such is just a really important process for treating anxiety. There are also a lot of lifestyle adjustments that we know are really helpful for everyone, right? Spectrum or not. As physical activity protects against onset and aggravation of anxiety, nutritious diet is associated with lower anxiety and better sleep, right? We know that inadequate sleep aggravates anxiety. However, this is kind of a vicious loop, right? Because people who have poor mental health, who are suffering from high anxiety or high depression, are less likely to be physically active or eat well or to sleep well. And so it's one of those things that, like, it's a loop. It's like a negative feedback loop where You're not doing well in these areas, and so your anxiety worsens, which worsens these lifestyle areas, which worsens your anxiety. So making the changes needed to address these things is really hard. It's a really hard thing. It's not as easy as just saying like, "Oh, just eat better and sleep more." The support of therapy can be really helpful in making these lifestyle adjustments, in increasing your physical activity, in making small changes to your diet, in helping your sleep hygiene. So these aren't necessarily things that people should be expected to do and be successful on their own. Therapeutic interventions often prioritize these lifestyle adjustments and provide support for this process. Okay, so I want to talk a little bit about the medical and social models of disability. When we think about disability, there are two main schools of thought. There are other models that have been developed, but these are the two most prevalently focused on and the two that we see most often when we think about treatments. So, from the medical model, this is where we focus on the biological aspects of a disability and how they're different from what we would call typical functioning. So, the emphasis here is on fixing or improving an internal aspect of the individual. And keywords, things that might cue you to be thinking about the medical model, include things like cure, treatment, intervention, therapy, deficits, impairments, etc. So that's the medical model. A lot of what I've talked about so far is within the lens of the medical model. The social model, however, focuses on the barriers that exist in our society that prevent individuals with disabilities from participating in home and community life. So here, disability is seen um, more as the restrictions imposed by society, things happening outside of the individual rather than something that's internal. And the emphasis is on changing and adjusting both the physical and social environments to promote inclusive functioning. And so, keywords here are things like support, accommodation, attitude, stigma, universal design. We've gotten much better as a society at thinking about the social model when it comes to what I would call more visible disabilities, right? Things that are very physical in their presentation. And so here's just a general example. I'm using someone with a mobility related disability. So this is an individual who has trouble ambulating, walking around. And so thinking about them from either of these perspectives, from the medical model, you might be looking at treatments like surgery and medications, physical therapy, maybe just general strength training, maybe some complementary and alternative medical practices like acupuncture, etc. A lot of things to fall under that medical model umbrella. However, we're also more apt these days to be thinking about things that fall within that social model. Could that individual benefit from a wheelchair or other mobility assistance device that would meet their individual needs and abilities? What about accessible housing, ramps, counter height, room in the bathroom, etc.? What about transportation? Are they able to access transportation and how can we make that more accessible for them? Accessible neighborhood and community settings. So, the workplace, the school, the neighborhood, the sidewalks, right? All of those things. How can they be improved to be more accessible for someone with a mobility related disability or who's using a mobility assisted device? And then we're also thinking about stigma and discrimination, right? Making sure that we are thinking about how we can be actively inclusive for individuals with this type of disability. Like I said, I think we've been getting better when it comes to these very clear, and clear, I say like visible disabilities. In terms of something that's more invisible, you're walking down the street and you see someone and you might not be able to quickly identify what their disability is. We still have a ways to go. And that's not to say we have gotten perfect at this. If you look at the state of our sidewalks and the accessibility of our schools in Hawaii, you will definitely see that we have a long ways to go when it comes to accessible um, communities. In thinking about autism and anxiety within these two models, there are some things that come up, right? And thinking of from the medical model, we're thinking about both autism and anxiety as medical conditions, neurophysiological, that have genetic bases that cause impairments in someone's functioning. And then from the social model, we're also thinking about how individuals who have both autism and anxiety have functional limitations due to the environmental and social barriers that they encounter around. So, I want to move toward the more holistic model, right? How can we be thinking about both the medical and the social models in thinking about how we can better support individuals with autism and anxiety? In thinking about this, I think what's something to reference is the minority stress theory. So, this is a theory in psychology that has a lot of evidence behind it that basically posits that people from marginalized groups, whether those are racial minorities, LGBTQ plus, people with disabilities, etc., any sort of marginalized community, they experience unique stressors related to that social identity, which comes with increased discrimination, prejudice, as well as internalized stigma. We see this compounded by a lot of different forms of social discrimination, right? Things like verbal harassment, social exclusion, systematic inequalities in healthcare access, etc. And we also know that people who have multiple marginalized identities may encounter unique stressors that heighten their vulnerability to mental health issues. So, in thinking about autistic individuals who are often from other marginalized communities, right? Autism doesn't discriminate based on race or ethnicity, it's present in all social groups. But we also know that there's a higher rate of individuals with autism identifying as LGBTQ, for example. These individuals might have even more stressors that might impact their mental health. And there's research to support this, right? We have seen that isolation and lack of social support can exacerbate feelings of anxiety and depression. We know that community belongingness is a protective factor against mental health outcomes associated with inactive stigma. And we also know that autistic adults um, experience everyday discrimination, and that discrimination, internalized stigma, and concealment significantly predict poor mental health, even when we're controlling generally for general health exposure or general stress exposure. So, what this means is that individuals with autism are definitely being impacted in their mental health by these sort of environmental and social aspects of their lives. In looking at the research some more, we see that youth with autism are at a considerably higher risk of being bullied than their neurotypical peers. And we know that bullying is a risk factor for both depression and anxiety. It has significant mental health impacts. We also see discrimination in educational and workplace settings. So, not just bullying for children, but we're talking about teenagers and adults as well. And we also see very high unemployment rates among autistic adults, despite a higher educational attainment. So even despite having a higher degrees and so on, autistic adults are more likely to be underemployed and unemployed. So in thinking about the medical model and social model, right? Within the medical model for anxiety and autism, we have these treatments, right? We have psychopharmaceuticals or medication, we have cognitive behavioral therapy, CBT. There are also a lot of other treatments that I haven't really mentioned. Mindfulness and relaxation strategies are really helpful. Exposure based therapies are great, especially if you're thinking about phobias. And we also have complementary and alternative medicine, so things like acupuncture, herbs, melatonin, etc. We have compensatory capacity building. So, helping an individual with autism by helping them learn coping skills or by helping them improve their social communication skills to kind of offset some of the anxiety, as well as these lifestyle adjustments that I mentioned before to physical activity, sleep hygiene, diet, and nutrition. Within the social model, we have a lot of other things, though. And this is the side that we often neglect when thinking about mental health and anxiety for autistic individuals. A lot of environmental supports can be really helpful. So, thinking about accommodations in school or the workplace, access to a quiet and calming space, access to sensory input, whether that's movement breaks, fidgets, soft textures that are soothing, use of tools to reduce sensory input. So, noise canceling headphones, advanced notice of schedule changes, support with transitions, visual supports. All of these things can help support an individual with autism and help reduce their anxiety. Also, in thinking about the physical environment, we can be thinking about making our environments more sensory friendly, reducing stimulation. And we can also be thinking about utilizing multiple modes of communication. So, in workplace settings, there are often a lot of social expectations, cultural expectations about how we communicate with each other, whether that's through email or chat or in person meetings or remote work and so on. And so, thinking about the ways that people best communicate, as well as their preferences for communication, and really allowing flexibility to help support the needs of individuals who are both nervous as well as autistic. And then we have a much broader social environment where we really need to be working towards acceptance of neurodevelopmental differences in general, right? Reducing stigma and judgment, um, having uh, people be free to be themselves and not really being punished for having atypical communication or movement or so on. And this speaks to, I think, a shift in our behavioral treatment as well as how people conceptualize these behaviors in um, classrooms and workplaces and so on. We also want to be thinking actively about how we can promote inclusive practices and awareness, as well as anti bullying policies, both in schools and workplaces. And I would like to posit that from a holistic model, things from this social model side need to be emphasized more. We need to be thinking about these green boxes more. We need to be thinking about what we can do as a society to improve and really acknowledge that the levels of anxiety that individuals with autism are experiencing are not necessarily all due to their neurobiology, right? There's a lot of things at play in their environment that can be adjusted to help them be more successful. And I think this is something that's really important for parents to understand in terms of how they can support their children. It's important for clinicians to understand in thinking about treatment planning. And it's really important for us all to understand in terms of how we can be better at making our society more inclusive in general. Feeling like you belong and feeling like you have community is one of the best predictors of mental health, as well as lifetime satisfaction and physical health, etc., for everyone, and that includes individuals with autism. So I'm going to end with some resources before we get into our Q&A. I have some recommended clinician resources. So I have here two books. The first is Cognitive Behavioral Therapy for Adults with Autism Spectrum Disorder, and the other one is CBT for Children and Adolescents. These are two wonderful books for clinicians who are interested in thinking about CBT for working with this population. And there's also a really lovely article by Cooper and colleagues that talks about adapting psychological therapies for individuals on the autism spectrum. So, highly recommend this article as well as these books for those who are interested. For adults with autism, I have two resources that I think are really helpful. This workbook, Overcoming Anxiety and Depression on the Autism Spectrum, a self help guide using the CBT. And this is a workbook that someone can go through without the help of a clinician. It is really good to use in therapy with the support of a clinician as well. And then a book called Unmasking Autism. This is a really amazing book. It doesn't speak to autism and anxiety specifically, but I think it does speak to the difficulties that adults may face in their everyday lives with autism and how that can exacerbate anxiety. And sort of understanding that for yourself might be a big key in kind of conceptualizing your own anxiety and what would be helpful for you. For children, I have a workbook as well. What to do when you worry too much, a kid's guide to overcoming anxiety. This is a CBT based workbook for kids. Fantastic. I love it. It's not specific for kids with autism, it's for kids in general. I also have used it very successfully with adults with autism who need more visual supports and language accommodations. A book for parents, Helping Your Anxious Child, a step by step guide for parents. And this is by some great psychologists. It's very family friendly. I think it has great recommendations, and it's a nice way to kind of conceptualize how you're parenting might be impacting your child's anxiety and how you can adjust sort of your parenting to improve that sort of home environment to support your child. I have references here. There are a lot of them, but I do include them because I do share my slides. So I would really love for people to save these slides and reference them. If you want to go back and look at some of the articles that I linked to, if you want those links to some of those books, please, please, please get these slides. Here's a QR code as well as a direct link to the PDF slides from today's presentation. And I'm going to leave this up as we do our Q&A. I saw a ton of questions coming in over the chat, so I'm hoping, Jarek, maybe you can help read some of those out before we open it up to questions from people verbally.
Yeah, definitely. So one question was, will you be making your slides available for participants to see?
Yes, yes.
Okay. Another question was, does this research separate out PTSD as or C-PTSD?
Does it
Um,
separate it out?
it might be
Um,
for a specific part of your presentation, which
Yeah, this is probably related to the graph that I showed with prevalence rates. PTSD is listed as a specific diagnostic category on those. For those, complex PTSD is often included in that PTSD category. We know that individuals with autism, as well as other individuals with disabilities, are more likely to experience trauma in their lifetimes, making that rate of PTSD higher.
Another question, do you have any information on autism-friendly anxiety rating scales? Most current MH rating scales can be hard to access.
That is a great question. Excuse me. I think that there aren't really any good answers here. There have been some that have been made specific for research studies that aren't necessarily available for general use. Rating scales are tricky. Um, the way that parents and teachers often rate um, s- anxiety and autism often overlap in terms of social skills and socialization and all of that in terms of what's observable. Self-rating skills tend to be more helpful when it comes to understanding the internal cognition of an individual. However, that's really dependent on their own insight, their language level, etc., in order to communicate that. And I've also found that for individuals on the spectrum, self-rating skills can be really difficult because of their need for things to be very concrete. So, someone rating themselves on a scale from 1 to 4 for a typical individual might be like whatever. For an individual with autism, might be really hard to kind of figure out exactly where they are on that 1 to 4, thinking about it in a very concrete way. I often talk about in my own assessments how someone responds to the process of filling out a self-rating form is diagnostic information, sometimes more than their results on that form. And I think that's true for the anxiety as well. For assessment, it really comes down to getting as much information from as many people as possible. Talking to the individual as much as you can, talking to any caregivers and support staff, talking to teachers, people in other environments, talking to other family members. For adults, I talk to spouses and other family members to try and understand what's going on as well. Um, it's a difficult process occasionally for that assessment. But however, I do want to stress like it doesn't matter sometimes if it's anxiety or autism. If it seems like someone is anxious, if they're reporting anxiety, right? Like I would go based on that, regardless of whether a rating scale is indicating that. Sorry, that was
Um,
a long answer.
well, that's good. Someone asked, what is IU? I believe someone answered that. Intolerance of uncertainty. Is that correct?
Yes.
Okay, perfect. Uh, Sometimes the question of how much is autism is for eligibility questions, as ASD is developmental disability and anxiety disorder may be seen as a mental health issue. Any ideas around that issue?
Yeah, so this is tricky, especially when it comes to school-based accommodations, um, mental health conditions. Is typically really hard to receive accommodations specific for mental health conditions. As part of an IEP. It's easier if someone has a diagnosis of autism or an educational classification of autism. And so those individual needs can be sort of built into that IEP, even if those needs are related to anxiety and not necessarily the autism directly. The IEP will support that person globally, regardless of the classification. And obviously, that's like an IEP working in an ideal environment. That's often not the case, but you can advocate for your students' individual needs within the IEP, whether those needs are specifically related to autism.
Another question is Is CBT still effective for those with a language delay and or intellectual disability?
Great question. Yeah. So I mentioned that I use that child workbook for older individuals often. Um, so the approach, there's not a lot of research on this, unfortunately. This is something emerging and something I'm really interested in how we can support the mental health of individuals with autism as well as intellectual disability as and language delays, right? There are a lot of behavioral interventions for anxiety that can be very successfully taught to individuals with limited verbal abilities that are related to coping and relaxation and mindfulness and those physical activity and diet and sleep adjustments are appropriate as well. And CBT supports all of those things. So the approaches might be based more on those behavioral strategies. They also might be utilizing mm, sort of more uh, lower language level concepts and activities in the therapeutic intervention, but they're still very CBT based and they can be very effective. I've done CBT successfully for individuals who are minimally verbal in conjunction with their caregivers and support workers and the individual.
We are running out of time. So, and I do see you are leaving, but before you leave, if those of you who are still here, can you please take our post survey? If Dr. Lapis is uh, willing and wants to stay on and answer more questions, I can continue asking them.
Yes, for sure.
Okay. So again, I did put a link in the chat for our post survey, but we'll continue with the Q&A portion. So is there research on the effectiveness of DBT?
Sorry, I was just confirming that that link does in fact go
Was it not going to the right?
to the slides, and it should be working. The slide,
Oh,
the one that I put in the chat.
oh, okay.
DBT can be used very successfully with people on the spectrum. There's less research on it. Um, it is harder generally to adapt because it is a very verbally based intervention. There are behavioral strategies that are integrated, but the premise of DBT is often based on verbal communication within a group and with a clinician. And so there are just sometimes more adaptations that need to be made to that as a practice when working with individuals on the spectrum. And thinking about it from a group perspective, that group might not be a good fit, that group setting might not be a good fit for someone on the autism spectrum when it comes to processing their mental health. For others, though, it might be very helpful. So, again, it comes down to these ideas of individual skills and preferences, as well as what's effective.
Is is CBT still possible slash effective with non-speaking individuals?
Yeah, so I mentioned this a little bit before. Totally. It tends to be more behavioral, like I mentioned. Um, Thinking about relaxation strategies, lifestyle changes, coping strategies, visual supports for individuals. Um, Environmental changes are huge here. So, thinking about working with people who support that individual as well as the individual themselves, very, very effective. And it just sometimes maybe needs a little creativity from the clinician to think about how you can adapt those strategies to the needs of those individuals.
Okay. Any advice for getting an individual into therapy who has anxiety about therapy?
Yeah, that's really hard. Therapy can be really scary, and I know that from personal experience. It's a big thing to seek out help, especially with the amount of stigma that's associated with mental health in our communities still. Here in Hawaii, in particular, there are very high rates of stigma associated with both autism and mental health, and so it's kind of like this double battle. Um, Thinking about going to therapy can be especially overwhelming when you think about revealing your innermost difficulties, especially if you're someone who's more introverted, who has difficulty with expressing themselves, right? That might be really anxiety inducing, just thinking about having to do that. So I think something you could talk about in kind of promoting therapy for people who are scared of it is really thinking about how therapy isn't just about talking about yourself and your feelings. You can go to therapy and be very specific about working on um, applying for jobs and improving your sleep because you think those are the things that are going to help your anxiety, right? And your therapist can support you through those and use CBT mechanisms, and addressing those two goals might be sufficient for helping you address your anxiety, right? So I think it's more about conceptualizing therapy in different ways too, right? It's not just about talking about your mom and your relationship with her and uh, all of those types of innermost feelings and fears that does come up, and so for some people that is important, especially when we're talking about trauma treatment. Um, but I think in general, therapy can just be about support and skill building and really helping you be your best self. Um, and I think it's also really true that most, if not the vast majority of clinicians really like feedback from their clients about what is working for them and what will be helpful. And so if something isn't working with you with your clinician, you can just say, "Hey, like that doesn't feel comfortable to me. I don't like that." And the clinician should be able to pivot and make changes. And you can also shop around for a therapist who fits your needs. But it is scary. I think sometimes it's just a personal journey. I see a lot of parents trying to push their teens or young adults into therapy, and the teens and young adults aren't necessarily in a mental place yet for it. Not going to be super helpful. You need to be in a place where you are really seeking to make changes for yourself and to make improvements.
Are there any known resources for accessible housing for sensory processing differences?
Um, Resources for housing. Um, I'm not quite sure how to answer this question. So in thinking about accessibility for sensory difficulties, right, I often think about this in terms of workplace environments and schools. And so for workplace accommodations, you can be thinking about the lighting in environments, the amount of sound stimulation, access to quiet spaces, noise canceling headphones, right? Like those sorts of things, having access to your sensory soothing things and access to movement breaks. Same things for schools, same things for hospitals, really big thing. Um, for college campuses, in thinking about dormitories, right? This is something that comes up a lot. A lot of autistic students sometimes will seek out accommodations for a single rather than shared dormitory room because of these sensory concerns, where they can have more control over those sensory aspects. Um, we can all do better for this in thinking about our own environments and how to make them more friendly for people with different needs. And this goes beyond the sensory differences and needs of autistic individuals. This speaks to things just needing to be more universally accessible for people in general.
What is the current prevalence of suicidal thoughts in individuals with autism? And does that prevalence when there is full occurring anxiety?
Yeah. So, oh goodness, off the top of my head, I cannot remember the prevalence rate, but it is quite high. Um, so suicidal ideation um, is when someone has thoughts about committing suicide, thoughts of death, thoughts about being dead, or so on, and it is very serious. It tends to be more associated with depression rather than anxiety, but depression and anxiety often co-occur. Um, It is higher amongst the autistic population versus the neurotypical population. That goes along with the higher rates of anxiety and depression that we see for autistic individuals, which I think is really the amount of stress that they encounter on their daily lives, right? And the difficulty that they have in daily functioning. Um, it's something that's not talked about enough. It's not screened for enough in this population. Um, I think this could be a whole other book or presentation, and so I'm hesitant to get into a lot of detail about it. But there are a lot of resources if people want to reach out to me directly to learn more about that.
What would be the number one recommendation for the DOE in determining accommodations and eligibility?
Um, so for the DOE, I think so these are kind of two different things, right? Eligibility versus the IP and accommodations. For eligibility, I think it's really important for the assessment to be holistic. The emphasis is often on academic functioning, um, and that tends to look at abilities rather than how people are actually performing in real life in the classrooms. So, considering academic function broadly as it should be, not just about grades, but about how is this individual in the classroom? Are they really stressed out? Are they going home with a stomach ache every day and vomiting between classes because they're so anxious, right? Like, are they not talking to anyone? Can they participate in group projects, right? Like all of these other aspects about functioning in an academic environment beyond just grades should be considered as part of that eligibility process. And that goes, I think, to those accommodations that are necessary as well. To be successful academically, I think you need to be functional in a classroom. And that goes to a lot of things beyond your math and reading abilities.
And this will be the last question. Are there any techniques for a person with IDD to physically recognize their anxiety in the moment so they can start to use a strategy?
Yeah, this is something that can be taught over time. So it typically involves the teaching of specific coping skills first, practicing when someone is not anxious, supporting that practice when someone is anxious over time, having visual aids to support with those coping strategies, and having that plan kind of in place and helping the individual learn that plan. And with time, the signs of anxiety onset become more clear to that individual as they engage that plan and practice that plan and use that plan in response to anxiety. So it's part of a larger treatment when we think about coping skills.
Besides those responses, there's many, many thank yous and mahalos to you, Dr. Mayanakis. Thank you again for uh, being our speaker this month. Thank you, everybody, for attending. I will send a follow-up email that will contain links to our website that will have the recording of this presentation posted there, as well as a link to our post survey. So thank you, everyone, for coming. And this will conclude our September uh, guest speaker session. Thank you,
Thank you,
everyone.
everyone.
Have a good day. Bye.